Welcome back to episode 2 of the Low Back Pain Podcast. I'm your host, Dr. Grant Elliott with RehabFix online low back program. And today's topic is sciatica. What is sciatica and what can you do about it? So there are 3 main theories behind sciatica that we're going to explain. But first we should define it. What is sciatica? Sciatica is a loose term. It is a general term, and it basically just means pain radiating down the back of the leg. So first off, I want to be very clear that sciatica is not a diagnosis. Although I use it all the time, I tell clients that they have it all the time, and we use it all the time. Technically, if you want to look on a clinical level, it is not a diagnosis because it just means pain down the back of the leg. So if you were to, get hit in a football tackle or something, and you have a Charlie horse in your glute, and that's causing radiating pain down the back of the leg, well, that would be sciatica. If you have a SI joint issue, and that is causing radiation down the back of the leg, that is technically sciatica too. So there's many different things that can cause sciatica, but sciatica is most closely associated with disc or sciatic nerve related pain. What are the main causes of sciatica? There's 3 main theories. The first one is the most common, which is a disc is bulging or herniating out, and that is directly pushing on a nerve or a nerve root. And that mechanical pressure on that nerve is what is causing the irritation and is what is causing those symptoms down the leg. Scenario number 2 is that the IVF, the hole that the nerve exits from the spine, where it exits out to then go down the limb, is becoming smaller. It's becoming stenotic. It's getting more narrow. And that narrowing is causing pressure on that nerve root as well. So it's kind of suffocating it, right? And that's causing the irritation and the symptoms down the leg. And scenario number 3 is that there's just some disc irritation, or the environment close to where that nerve root is inflamed and irritated. And there are chemical mediators all in there, nasty inflammatory mediators that are causing inflammation of that nerve root. So not direct pressure from the disc, but rather chemicals, inflammatory mediators that are causing these symptoms to go down the leg because of an irritated or inflamed nerve root. Now, the reason why people tend to find that bending forward most commonly irritates the sciatic nerve, it's not all the time. Sometimes it's bending backwards, sometimes it's bending side to side, but most commonly people notice that bending forward causes the sciatica to increase. Here's why. I want you to imagine that there's a rubber band tied from the back of your head, down your back, down your glutes, down your legs. So it's attached on the backside of your body from your head to your heel, all right? When you stand straight up and down, that rubber band is neutral. When you bend forward, that rubber band is stretched along the back of your body. Well, if there's a rubber band and it's compromised, let's say there's a little cut in it or something, and you really stretch that rubber band, it is not going to maintain the same integrity that it would if it was totally whole and normal, right? It would be a little bit irritated. So when you have sciatica and your nerve is irritated, it doesn't want to be stretched. So just like that rubber band where it has a little cut in it maybe, it doesn't want to be stretched because it's compromised. So the nerve does the exact same thing. It doesn't want to be stretched. So when you pull on it and you bend forward and you stretch that nerve, it is tugging on that irritated, inflamed location. And it is sending these pain signals because it's saying, hey, we do not want to stretch. We don't want to do this. This does not feel good. This does not feel good at all. And we want to limit your movement so you do not risk inflaming the nerve more or irritating the disc more. Because also what can happen in some individuals is when they bend forward, the disc sometimes puts more pressure backwards or on that nerve, and that could be increasing the symptoms as well. So that's why most commonly people feel these symptoms when they bend forward. So what's very important is to figure out the mechanisms behind your sciatica. Do they get worse when you bend forward? Or do they get worse when you bend backwards? Or do they get worse when you bend side to side? Or when you squat? What are your triggering movements? And based on your triggering movements, it will help us identify the movements that will be alleviating for you. The ones that are going to help calm down the nerve irritation, calm down the disc irritation. And the ones that reduce the sciatica are the ones that are ultimately going to need to be progressed and will truly resolve the root of this issue so that you do not have to deal with it any further, and it will be a true long-term solution. So some people think if they have sciatica down the back of the leg that it has to be a disc herniation, or it has to be stenosis, or it has to be a nerve root irritation thing. It can be a combination of these things. It can be one or the other, or there's multiple options that it could be. So it's important to understand if you actually have true sciatica, or should I say radiculopathy or radicular symptoms down the back of the leg, which is specific to the nerve site, or is it something else that is causing these symptoms down the leg? This is why a proper assessment is key. But like I said earlier, most commonly, if you're bending forward and you are feeling that sciatica increase, or you're feeling one hamstring or one calf is tighter than the other, that is most likely related to some disc irritation or some nerve irritation. And that whole rubber band analogy we use is the reason why the symptoms are increasing. So our first step is identifying the movements that are going to pull the symptoms out of the leg. That tells us that the nerve is getting better, and that tells us that we are on the right track. So look out for movements that reduce the symptoms in the leg. And if you want help finding movements that are going to reduce symptoms in the leg, then contact me and I would be honored to help you find what these movements might be. I hope that you learned something from this about sciatica and some of the mechanisms behind it. If you did and you're enjoying this podcast, please rate, review, and subscribe so you can help others find solutions to their low back pain as well. Have a great day, guys, and thanks for listening.